Corie Robinson is no stranger to University Health. She's a graduate student in pharmacology at the neighboring LSU Health Sciences Center, and she delivered her twins at University Health.
That morning my water broke. I was getting ready to come into class, and they were delivered that evening.
The problem was Dexter and Skylar weren't due for another 2.5 months. Dexter weighed 2 pounds 13 ounces. His twin sister Skylar just 2 pounds 9 ounces at birth. The pair spent 5.5 weeks in the neonatal intensive care unit. From day one, though, the two were fed their mother's breast milk.
When I found out I was having twins, I thought, okay, well, this is going to be a challenge, but this is something that I still want to do.
University Health leaders are hoping more mothers will follow suit. That's why the hospital has started the process to become a baby-friendly hospital. The initiative was started by the World Health Organization and UNICEF in 1991, and certification comes from the international organization.
But this is a community effort, and what we're really talking about here is building the bonds starting in the hospital where most women give birth, but really continuing and strengthening that bond across our staff, across our students, and across communities, because that's what counts.
According to the March of Dimes, Louisiana gets an F for babies born prematurely, and 1 in 9 babies in Louisiana are of low birth weight.
One of the most highly effective preventive measures a mother can take to protect the health of her infant and herself is to breastfeed.
Studies show breastfeeding reduces the risk of ear infections, asthma, and skin allergies in babies. It also reduces the chance of sudden infant death syndrome by more than 1/3. For mothers, breastfeeding can reduce the risk of a number of health problems, including high blood pressure, diabetes, ovarian, and breast cancer. There are 10 steps to attain the baby-friendly designation, including working to change policies, practices, and cultures. That won't be easy. Currently, just over half of Louisiana mothers breastfeed. Nationwide, that number is at 79%. And in the Bayou State, only 13% of infants are solely breastfed for the first 6 months of their life.
We've already made significant advances here at University Health. The mothers of our tiniest babies in our neonatal intensive care unit are better supported to express their milk, and we now have twice as many of our tiniest babies receiving milk as their first feed, human milk as their first feed.
And Corie Robinson strongly believes it was her breast milk that put her twins on the right track.
They're actually doing really well today. They're on track with all their milestones. They're still a little under the growth curve, but that's to be expected because they were so early. But I mean, they haven't had any, ear infections, any major problems with development thus far.
University Health leaders hope they can garner enough support to earn the designation, making it the only baby-friendly hospital in North Louisiana. For the University Health News Network, I'm Ed Walsh.